Diagnostic imaging is a pillar of modern medicine, but its delivery model is undergoing a radical transformation. The catalyst, a permanent CMS ruling on virtual supervision for key tests, signaling a new era in healthcare. This isn't just a policy update, it's a direct response to a looming crisis, a 42,000 radiologist shortage. And counterintuitively, going virtual doesn't mean less safety. Data shows it can mean 30% faster responses to adverse events. We'll break down the operational gains, the expansion of access, the real-world challenges, and the technological future of imaging. This transformation has deep roots. Teleradiology isn't new. It dates back decades, evolving alongside digital technology. As early as the 1990s, studies proved remote imaging prevented risky patient transports from rural areas, a core benefit now being scaled. Today, the economic case is undeniable. Virtual supervision directly cuts operational costs tied to on-site staff, travel, and overtime. Beyond pure cost, it streamlines the entire workflow. It dissolves scheduling bottlenecks and frees radiologists for diagnostic work. This efficiency allows a single specialist to oversee procedures across multiple sites at once, a massive force multiplier for health networks. So, the system gets cheaper and faster. But does that translate into better care? The answer is one word: access. Here is why this matters to communities. Virtual supervision untethers service hours from on-site staff availability, allowing for evening and weekend appointments. But its most profound impact is on healthcare equity. Millions live in underserved areas, facing dangerous delays in diagnosis. Virtual supervision shatters this geographic barrier. A specialist in New York can oversee a contrast CT scan in rural Montana in real time. This remote connection also transforms medical training. Trainees get frequent expert mentorship from specialists anywhere, without interrupting clinical flow. This brings us back to that 42,000 provider shortage. It's not about finding more people. It's about better deploying the expert workforce we have. The system works better, the access is wider. But what is the human impact on the people at the heart of it all, on patients and providers? For radiologists, the flexibility of remote work directly reduces burnout, helping to retain critical talent in a strained field. For patients, the results are just as positive. Virtual consults at the point of care improve communication and understanding of their condition. This satisfaction extends to referring physicians. They get clearer, more immediate communication from radiologists, closing gaps in care. The benefits for access, efficiency, and satisfaction are clear, but implementation isn't a simple switch. What are the real-world hurdles? A major challenge is the regulatory patchwork. While CMS acted federally, conflicting state laws can still require physical presence. Security and privacy are also paramount. Adherence to HIPAA demands secure, documented two-way communication systems, a non-negotiable requirement. Then there's technology itself, like AI, which promises to augment diagnostics by spotting abnormalities the human eye might miss. But AI's impact isn't uniform. Research shows its benefit varies by radiologist. For some, it boosts performance. For others, it can be a hindrance. So we have regulatory friction and nuanced technology. How do we ensure new tools become powerful allies, not another complication? Perhaps we're looking at AI the wrong way. What if its greatest strength isn't just finding disease, but fixing our broken workflows? This is the key. AI's other superpower is automating routine work, sorting images, and doing preliminary checks. It supercharges operational efficiency. This workflow optimization creates a powerful synthesis. Technology and remote supervision work together to solve the workforce crisis. This brings us full circle. The CMS policy wasn't just about imaging. It's the foundation for a future where diagnostics and telehealth merge. A patient gets a scan in a rural clinic, supervised by a remote specialist, analyzed by AI, leading to an immediate virtual consultation. Virtual supervision isn't just a concept, it's a proven model that delivers expanded access, greater efficiency, and higher satisfaction. It is fundamentally reshaping healthcare by applying technology and smart policy to solve some of our most persistent challenges. This is more than a new tool. It is a paradigm shift from a location-based model of care to a knowledge-based one. For healthcare leaders and policymakers, the question is no longer if you should adopt this model, but how you will build a more equitable future with it.